Hello and welcome to the topic Gallstone Diseases in the module Gastroenterology and Hepatology. By the end of this topic, you should be able to define gallstone diseases, explain the pathophysiology of gallstone diseases, describe the clinical presentation of a patient who presents with gallstone diseases, outline the investigations in the diagnosis of gallstone diseases, and finally, discuss the principles of management of gallstone diseases. Let's get started. Gallbladder diseases are diseases involving the gallbladder and is closely linked to biliary disease, with the most common cause being gallstones. A gallstone is a stone formed within the gallbladder out of precipitated bile components. The term cholelithiasis may refer to the presence of gallstones or to any disease caused by gallstones, and cholelithiasis refers to the presence of migrated gallstones within bile ducts. Gallstones are hard, pebble-like structures that obstruct the cystic duct. The formation of gallstones is often preceded by the presence of biliary sludge, a viscous mixture of glycoproteins, calcium deposits, and cholesterol crystals in the gallbladder or biliary ducts. The most common type of gallstone is called cholesterol gallstones, often appearing yellow in color. Pigment gallstones, on the other hand, are dark brown or black stones which form when the bile contains too much of bilirubin. What particularly causes gallstones? Because cholesterol appears to play a role in the formation of gallstones, it is advisable to reduce or avoid eating too much food with high saturated fat content. Symptoms of gallstone diseases may vary depending on what the condition is. If someone complains of having fever, with headache or other pains in the body, then you might want to suspect the presence of an infection caused by gallstone diseases in this context. The first signs of bad gallbladder would include abdominal pain, specifically right hypochondriac pain and tenderness, which we call Murphy's sign on palpation. Patients also will be having nausea or vomiting if the condition is severe. Presence of fever and chills, as mentioned earlier, could indicate an evidence of an infection. Sometimes there might be gastrointestinal disturbances as well, as patient may come with chronic diarrhea. Jaundice is another sign if there is obstruction of the biliary tree where there is reduced excretion of excess bilirubin in the body. In looking for additional signs of gallstone diseases, patients might be having, as mentioned, tenderness in the abdomen, pain beneath the right shoulder blade, abdominal pain lasting several hours or sometimes days, and pain that worsens after eating a heavy meal. So gallbladder problems are diagnosed through various tests. This may include a liver function test, which is a blood test that can show derangement in the bilirubin levels, as well as any significant liver enzymes elevation. Apart from that, you may also want to look for blood amylase levels, as the complaints of abdominal pain might be similar to pancreatic causes. Lipase levels are also done to look for inflammation of the pancreas if there could be an evidence of gallstones causing obstruction of the pancreatic ducts. In patients with suspected gallstone complications now, other blood tests also can be done, such as full blood cell counts with differential, and this is particularly to look at any evidence of infection. Patients with at least one gallstone smaller than 5 mm in diameter have more than a 4-fold increased risk of presenting with acute biliary pancreatitis. Imaging studies that can be conducted in patients with suspected gallstone diseases include ultrasonography. Here you'll be able to visualize a distended gallbladder with minimal thickening, filled with anechoic fluid, and if there's any presence of impacted stones in the neck of the duct. Importantly, ultrasounds are used to look at any obstruction of the biliary tract caused by gallstones. CT scans, on the other hand, are used to look at equivocal findings on ultrasound. So if the findings are absolutely normal on ultrasonography, however, clinically it is pointing towards a gallbladder disease, CT scans are more defined in looking at possible level of obstruction or area of obstruction. So it's clear to show the gallstones as well as if there's any complications present, such as infections, blockage of the gallbladder or the bile ducts. In patients with asymptomatic disease where the gallstone or small polyp was found incidentally, no further treatment is undertaken until symptoms arise. When an individual has symptomatic gallbladder disease and early stage cancer, a cholecystectomy is utilized. A cholecystectomy is controversial in advanced cancer due to the low 5-year survival rate, especially if regional lymph nodes are involved. Symptoms of gallbladder disease, however, typically decrease after cholecystectomy unless the abdominal pain was caused by other digestive tract diseases such as irritable bowel syndrome. Non-surgical treatment of gallstones and cholecystitis include medication therapy, which are used to dissolve the stones. Quinodeoxycholic acid with ursodeol more commonly used due to their side effect profile. It will take approximately 2 years to dissolve small stones with medications. Acute cholecystitis is usually first treated with antibiotics to settle the infection, and then keyhole surgery is done to remove the gallbladder. When it comes to antibiotics for cholecystitis, oral antimicrobial agents which can be used are usually targeted towards the community-acquired and healthcare-associated depending on the setting. Penicillins are used, such as amoxicillin, clavulanic acid, cephalosporins such as cephalexin, and fluoroquinolones such as ciprofloxacin or levofloxacin. So can cholecystitis be treated without surgery? Laparoscopic cholecystectomy remains the surgical choice for symptomatic and complicated gallstone diseases with a shorter hospital stay and shorter convalescence period than open cholecystectomy. Percutaneous cholecystectomy is an alternative for patients who are critically ill with gallbladder empyema and sepsis. Although cholecystectomy is generally recommended for acute acalculous cholecystitis treatment, non-surgical management can be considered in patients at high risk for surgery. So in summary, we have looked at the different gallstone diseases and what they essentially cause, the pathophysiology of the gallstone diseases, what are the clinical manifestations the patient can come with if they had one or more than gallstone diseases discussed, investigations that can be carried out to investigate the cause as well as the severity of the disease, and lastly, the approach of treatment, i.e. medical or surgical approach depending on the severity and the disease that the gallstone has caused. We have come to the end of this session. Thank you.